Hello, everyone. I hope you're all doing well in your classes and staying safe at home during these unprecedented times. It's unfortunate we all couldn't be together at school, but nobody could have foreseen the outbreak of COVID-19 or coronavirus. It's actually what I wanted to talk about today. I didn't realize how serious this pandemic was until I traveled home from school to my home in Massachusetts, just north of Boston. Soon after I got home, I heard that one of my friends from high school recently lost his grandfather due to complications with coronavirus. For this, I didn't think too much of the virus because I couldn't put a face or name to anyone affected by it. When someone I knew personally was devastated by it, I realized that any one of us could lose a loved one to coronavirus. The worst part about my friend losing his grandfather was him and his family couldn't even attend a proper funeral because of the social distancing guidelines. Because Massachusetts is being hit so hard by this pandemic, currently ranked third highest state with over 54,000 cases, according to worldometers.info. I've done a lot of research online about how the virus spreads, how to avoid contracting and spreading the illness, to make sure I didn't get myself or my family sick. What I've found is that the best thing we can do right now is nothing. Stay at home as much as possible and take the necessary precautions to stay healthy and prevent coronavirus from spreading. Limiting your time outside could potentially save thousands of lives and help get our economy on its feet again. But you might be thinking, it's not bad in my state, I should be fine, or I don't feel sick, I don't have coronavirus. These assumptions may not be true. We need everybody to quarantine. The virus is affecting every state and every region in the US, with just under 1 million total cases, which is growing exponentially, which you can see on the graph to the left here. With the total cases rising, so do the total deaths. We're currently at 54,413 deaths, increasing every day. Daily deaths peaked on April 21st at 2,683, but it's continuing at this number. It could start to rise again, given that a measurement taken too recently to determine a constant decrease. The scary part is, symptoms may not even show, but you can still transmit the virus. It may seem this virus is unstoppable, but there is a solution that will help him from spreading. The New York Times gave 4 pieces of advice to follow based on recommendations by healthcare professionals. 1, to prevent infection, slow the outbreak by keeping yourself and others from getting sick. Wash and sanitize your hands, clean often, and wear a mask in public. 2, prepare. Stock up on food responsibly and create a household plan. Don't hoard supplies, just take as much as you need. 3 is stay at home. Stay at home to protect others and use these strategies to keep life as normal as possible. Practice social distancing and avoid contact with others. 4 is recover from illness. If you or a family member gets sick, make sure nobody leaves the house. The infected person is isolated, and everyone is monitoring themselves in case they develop symptoms. The CDC gives specific guidelines on how to practice social distancing and clean yourself effectively. Social distancing includes staying at least 6 feet apart from other people, not gathering large groups of up to 10 people, and stay out of crowded spaces. Proper cleaning includes washing your hands frequently with soap and water for at least 20 seconds. Frequently disinfect surfaces that are often touched, like doorknobs. Cover your coughs and sneezes. Wear masks that cover your mouth and nose. And when soap and water is not available to wash your hands, use hand sanitizer with at least 60% alcohol to disinfect hands. The disease is transmitted through person-to-person contact, and if residue from coughs or sneezes get into someone's eyes, nose, or mouth. Anna Miller at Business Insider says it's important also to look after your physical and mental health during long periods of isolation. She says to make sure exercise every day. It keeps your immune system to stay active and keeps your metabolism high. You also need to set routines for yourself. Wake up at the same time, eat at the same time, and sleep at the same time. Make sure you're eating healthy foods. Eating poorly, like fast food or snack foods, directly affects your immune system, which could raise your risk of infection. And of course, make time for social interactions, but via video calls like Zoom. All this will help keep your mind and body active, preventing mental illnesses like depression from encroaching. Now you know the procedures for quarantining and how to stay healthy, recommended directly from health professionals. But there are 2 possible futures after coronavirus, and they're not too far away. You can see from all the data here that The deaths and cases are increasing rapidly with not too many signs of slowing down. Our future, if we don't follow quarantine procedures, millions of people will get infected, hundreds of thousands, possibly even millions will die. Hospitals will be completely overrun and will have no room for patients to be treated. We already lack the necessary amount of medical treatment for those infected now. If it doesn't slow, then we won't be able to treat anyone who needs it, everyone who needs it. Our scientists' efforts to come up with treatments and vaccines will be slowed, and we may not be able to open businesses back up, which means millions of citizens will lose their jobs, many of which are already struggling to feed their families, and who knows, maybe our economy may not recover. Alternatively, if we do follow quarantine procedures, none of that will happen. Instead, the current rate of infection will flatline, meaning no more people are getting sick. People can go back to work, and medical experts can complete the development of treatments and procedures. According to WebMD.com, we're currently looking at around a 12 to 18-month quarantine at the best case scenario. So make sure we do our part to prevent that period from extending any further. Coronavirus is devastating the entire world, not just the US. But with the United States having the highest number of confirmed cases and deaths related to coronavirus, we need to do our part. Things may seem bleak, but let's all rally against this invisible enemy, as President Trump might say, and play a part in the solution. Stay at home, prepare to remain at home for long periods of time. Clean your hands and living area often with proper cleaning supplies. If you must go out, practice social distancing guidelines and wear a mask. Finally, monitor yourself and keep an eye out for possible corona symptoms. We need to stick together and support each other in these trying times. Long periods of isolation like this quarantine can have negative effects on our physical and mental health. To prevent this, make sure we're eating healthy, exercising, and getting some social time in with video calls to friends. Stay safe, everyone, and go Cox.